Welcome to Rewired Sober, the podcast that breaks down the real reasons women turn to alcohol. Spoiler alert, it wasn't a character flaw. It was your neurobiology, your conditioning, and the systems that taught women to silence themselves instead of support themselves. I'm your host, Kate Vitella. I've been a registered nurse for well over 2 decades, trained in addiction and mental health, a bit neuroscience obsessed, but spiritually grounded. This is the science and soul work of a woman's recovery, where I help you understand what's happening in your sober brain and reconnect to that deeper inner truth you've always had, that soul level knowing, the intuition the patriarchy has tried to train out of you. When women combine the science of the brain rewiring with that inner knowing, you stop feeling broken and you start feeling powerful. So let's get into it. Welcome back, folks. It is a rainy, nasty day here in the Pacific Northwest. I'm recording this on January 6th. I'm not sure when I'm going to put this out, but it was important to me to have this discussion because there's a lot of noise on the internet, and oftentimes I post things and I wonder if people actually get what I'm trying to say. Recently, I posted this giant block letter that said, "Don't confuse the word dis-ease with the word disease." And what that was referencing was the disease model of addiction, essentially. And where I wanted to give a little backstory where I was coming from on that. A couple of years ago, I attended a coaching conference, I guess it would be. It was a virtual conference with Tommy Rosen. And if you don't know who he is, I highly advise Googling him. He's amazing. Yoga and yogini, if you would say. He's a public figure, an addiction expert. He's been sober, over 25 years. Has a lot of really good stuff to say. His platform is called Recovery 2.0, focusing a lot of somatics and breath work and yoga. Highly respect. And I've learned a lot from him. Someone who was brought up in the 12-step model and then one day just said, this isn't working. And has gotten a lot of criticism for that. So I can identify with that. But I thought I would talk about this kind of from a nursing perspective and also from a woman in recovery perspective, and how I came to understand this whole model of addiction and where it came from and how it's evolved for me over time. And I hope this helps make some sense of it because, like I said, we've got armchair quarterbacks all over the fucking internet. And I'm not saying I'm any better than half the people that are spouting all this recovery stuff, but I am educated. And so I think you kind of have to be careful that you don't fall into just assuming that someone has the gospel, knows the thing without doing your own research. I was going back and forth in a very respectable discourse with someone that I love on social media. And we were, I can't remember, I think we were talking about relapse, which I don't even use that word. I kind of just say you return to alcohol or you return to the substance or to the shitty husband or whatever, right? I mean, we're human. Shit happens. That's me as a coach. You come to me and you're like, I have this problem. I say, you know what? Shit happens. All right. No, I'm just kidding. But basically what I responded to her was something about, I don't feel like I have a disease. And she said, I have a chronic relapsing brain disease. And I was like, well, of course you do. ChatGPT, Google for the win, right? That's what we've called it. When you Google it right now, it will say you have a chronic relapsing brain disease. And I can't negate that, right? So let's get into how addiction came to be defined as a disease and why that definition seems to dominate medicine and culture Now, I'm going to talk about the pros and cons here, where it falls short, and what neuroscience actually tells us about how people change. So, like I said, most people hear addiction and it's described as a chronic relapsing brain disease. And that phrase shows up everywhere. It's in doctors' offices. It's in treatment centers, for God's sake. It's in literature, treatment literature. It's in our court system, insurance policies. That's common lexicon when you Google it. And I wanted to be really clear that, I'm not saying that addiction isn't a disease because it isn't serious. And I'm not saying we don't suffer because we do. I'm certainly not saying support and treatment and community isn't life-saving. What I am saying, though, is that the disease model is not a complete explanation. And for some people, it can be limiting. It can limit their recovery rather than support it. So I wanted to bring this to light here. So the disease model of alcoholism, it didn't come from neuroscience. In 1956, the American Medical Association officially classified alcoholism as a disease. Now, this decision was not based on identifying a specific biological defect in the brain. It was more of a social and medical strategy. At the time, and still, I would argue still to this day, people with, quote, alcoholism were viewed as morally weak, or worse, full-on criminal. And hospitals were turning them away. Hospitals avoided treating people. And insurance would definitely not cover care. It's bad enough today, circa 2026, to get your insurance company to cover anything beyond 7 days of acute detox, much less, week-long extended therapy. I mean, I don't know if any of you have had a loved one struggling, or you're struggling and you're looking into what your insurance will cover for therapy, for coaching, for rehab. It's like a labyrinth of different explanations. Good luck, basically. It's fucking sad. I mean, good luck. When I was really, really struggling, I had nowhere to turn. I didn't know what to do. Now, I'm a nurse. I've been a nurse for decades. My parents were trying to help me. My mom's a nurse. She's retired now, but my stepdad is a retired physician. He was actively working as a physician at this time. This was 10 years ago. They're looking all over the internet. How can they help me? Where do they send me? What will my insurance cover? Who will take me? They couldn't find anything. It was so disheartening. Oh, you can't get into this program without this. Oh, you need 7 days or 30 days clean to get into this. Oh, you don't qualify for detox. I mean, it's bad enough now, right? Quick pause here, folks, because some of you might be listening to this and thinking, okay, I'm on a sober journey, but I still feel stuck. Yeah, that's normal. Removing the alcohol is one thing. Rewiring the brain, rebuilding your actual life is the real work. And that's why I created the Rewired Sober coaching program. It's 3 months where we combine neuroscience, soul work with weekly live support calls so you can actually understand what's happening in your head and your body. You can start anytime, you get immediate access, and you don't have to figure this all out alone. If you're ready for transformation, the link to join is in the show notes, and I hope to see you there. Now back to the show. So back to my point, back in the 50s, insurance companies were like, yeah, that's not even a thing. Hospitals were like, nope, that's not a thing. I mean, we handcuffed Billie Holiday to the bed for addiction. That's a famous story. I don't need to go into the millions of stories of how we criminalize addiction. So calling alcoholism a disease really helped us move addiction out of that category, out of that stigma that it was a moral failing, and into a medical model. And that mattered big time. That was monumental. It was huge. It really helped to bring this conversation into the medical treatment lexicon. And I think later around the 1980s was when SUD, or substance use disorders, were more formalized in the DSM, which is the Diagnostic and Statistical Manual for Psychiatric Conditions. And all of this happened sort of alongside the rise of managed care and the need for standardization, the need to standardize diagnosis and expand psychiatry. So addiction could be something that was more codified. It could be diagnosed, medically coded with an ICD-9 code, and treated within the medical system. And this is essentially how addiction entered medicine. It was more of a classification, not really the discovery of a single cause. And it became the gold standard. Now, the disease model became the gold standard because it solved an institutional problem. It allowed for insurance reimbursement. It provided a standardized treatment pathway, and it protected healthcare providers legally. It offered a really clear narrative for policies, for courts. And as a healthcare system that relies on documentation and essentially on predictability, this was huge. I mean, as a nurse, we say, if you don't document it, it didn't happen. And if you can't provide a clear narrative for why something is a certain way, for example, as a nurse, we use in psychiatry as evidenced by these exact symptoms, because much of mental health is a gray area, right? We'll say someone is manic as evidenced by, or, someone is delusional as evidenced by. So essentially, documentation is super important. And this disease model really helps this in a medical treatment system. You can code it, you can diagnose it, you can bill for it. I mean, let's not forget how much we love money here, folks. You can bill for a disease. You can defend a disease in court. You can defend a disease when your family be shunning the fuck out of you, right? You can't bill for gray areas and for nuance. And so, this doesn't mean that the disease model is super accurate. It just means it is and was a more functional system. So who defines this? Like, if you put into Google or ChatGPT, Google's kind of a dinosaur now, like, what is the definition of addiction? It's going to say chronic relapsing brain disease. That'll come from many organizations, the National Institute on Drug Abuse or the American Society of Addiction Medicine. And this definition, it helps support funding. It helps support research grants and insurance coverage and essentially medical authority, right? Policy definitions. They're designed to protect access to care and resources. So, the problem is a policy definition is not the same thing as a full explanation of human behavior, right? For much of modern history, substance use was treated like a criminal issue. And this disease model really helped shift addiction away from something we punish and even something we talk about in a stigmatizing, criminalizing way, and something that we talk about more in a treatment perspective, from a treatment landscape, from a more empathetic landscape. And this is incredibly important. It was important back then, and it's important now. However, two things can be true. There's a trade-off for this model. In order to move addiction out of criminalization, we framed it up as a pathology. In order to essentially reduce blame, what we did sort of on accident was reduce personal agency. And we were really looking to gain compassion, But we adopted this narrative of permanence by saying it's a disease. And we ended up with a false binary, essentially, because it started out that you were morally bad, and that's why you had an addiction. And then we turned it into a disease. So then you're biologically diseased and broken, right? Some even say you're born this way. So those are your two options. But both of those erase the complexity of what it really is, right? We're often told that addiction is either A, a moral failing, or B, a disease. Like, those are your only options. But as we know, right, human behavior, it rarely fits in these binaries. No, addiction is not a character flaw. It's not because you're morally bankrupt and a piece of shit. But it also does not necessarily require a permanently damaged brain. And where I found more of an accurate explanation of what it is in terms of brain science, neuroscience, is using language around a learned behavior. And that's just understanding how the brain loves to form a pattern, loves to follow an algorithm. It's a learned behavior that becomes strongly reinforced under certain conditions. And so addiction, yes, involves the brain, but involvement doesn't necessarily equal irreversible damage. Because the brain changes in response to repetition, and it changes in response to repetition in many, many areas. In trauma responses, in habits, in anxiety, in stress patterns, and in substance use. So addiction essentially is a reflection of what we're learning. And another part of this was I read the book, The Biology of Desire by Dr. Mark Lewis, and I've mentioned this several times on the pod. Now, this is not my only basis of research. I have read several books and I've done lots of research, but this one describes it the best. And I think it's because he really comes at it from all of the approaches, right? Is it a moral failing? Is it biological? Is it hereditary? Is it because we're self-soothing? And what he comes to find is he describes it, and I think this is the best definition. It's a habit that you've learned shaped by emotional intensity. Because it's not like a regular habit. It's shaped by repetition, but also emotional intensity and reinforcement. Not like a disease process. Why I say emotional intensity is because we know there's all these neurotransmitters involved. Dopamine reinforces a behavior that's either going to reduce discomfort or increase relief. And when we're under stress, we're going to increase our reliance on familiar solutions. And overall, we build strength in those neural pathways through repetition. It's how learning in the brain works. So neuroplasticity goes on. It doesn't stop because someone develops an addiction. The same mechanisms that build a habit can also weaken them, though. And this is where you have to really understand brain science. So neuroplasticity means that the brain changes in response to experience. And rewiring will happen inevitably through repeated behavior, emotional relevance, right? And changes in our environment and shifts in stress and safety. And when you stop reinforcing that old behavior and repeatedly practice a new behavior or an alternative, then you form a new neural pathway. A new neural pathway gets formed and it strengthens. And then the pruning, the old pathway weakens through lack of reinforcement. And this can be a gradual process. It does take some time, some repetition, but it is an observable process. So in a sense, it's not really like when you're in recovery, your brain is healing from a, quote, disease. It's more like the brain is learning a new pattern. That's the way that I see it. And I think that this is a much more helpful way of understanding habit change and neuroplasticity and our hope in recovery. Now, the entire reason I'm recording this is because I feel as though the disease model reinforces permanence, and it can be really self-limiting. And so I want to open your eyes to some new ideas here. The other argument is that, honestly, sometimes people recover naturally without doing anything. And that can kind of really upset the apple cart of addiction is a chronic relapsing brain disease. And if you don't go to meetings for the rest of your life, you're doomed. I mean, we've all met someone who just, quote, quit drinking. Now, does that mean that they, quote, were never an alcoholic? I mean, God? I mean, who decides this stuff, right? I was once in a coaching container with a bunch of business coaches, and we were all talking about what our specialties were. And I said, well, mine is I'm a recovery coach. I help women in sobriety. And one of the women stood up and said, why? Like, what do they need help with? You just quit. And I looked at her like, are you insane? And she said, oh, I quit drinking like 8 years ago. I just gave it up. And I started exercising. And she literally thought that I was just like this hack. And really what it showed me was that you can recover with doing nothing. Now, we don't tell people that because it's oftentimes not the case. But I will tell you, I know plenty of people who just stopped. My husband is a good example. He went to a few AA meetings, worked the steps, and was like, I'm done with this. And he's almost 4 years sober. My sister, also a good example, went to a few AA meetings and was like, I'd rather die. Decided to go to therapy and join the gym, quit drinking forever. She's 8 years sober. Now, who am I to say whether they are, quote, real alcoholics or not, right? I don't think that would have worked for me. This was a deeply entrenched habit for me that came with a lot of other psychological issues. And I had put a lot on this. And not only did I do a lot of wreckage, but it just became so much of my identity. So for me, there's no way I could have recovered without a community and without, doing a lot of personal work. But people are naturally recovering and getting sober and not going to meetings. So how the fuck do we explain that? Right? Because here's what they're actually doing through, quote, natural recovery. They're reducing major stressors in their lives. They're changing their environment, changing their habits, shifting their routines, and they're taking on new roles. And they're finding other ways to regulate their emotions. They're going to the gym. They're seeing a therapist. They're taking up a pottery class. They're going walking, whatever. Anytime a person reaches a point where the costs outweigh the benefits, then their identity will change first and their behavior follows. I mean, from a brain perspective, this makes sense, right? And so it's hard for me to say like, okay, we all have a chronic relapsing brain disease because it's different for so many people. Now, natural recovery is going to be dismissed and not talked about because it challenges the idea that addiction is inevitably progressive and relapsing. Diseases usually follow a very predictable course, but learning-based behaviors don't. So, instead of being integrated, a quote, natural recovery is often dismissed like not real recovery. You'll either hear people say, well, they weren't truly an alcoholic, and or they're not really in recovery, and or they're a dry drunk. Now, this is not a scientific conclusion. This is just people throwing shit out there. Okay, so I'm going to get a bit into AA here. In AA, the disease definition is treated as an absolute fact. It's not a theory. And not identifying as an alcoholic and saying you have a disease is interpreted as denial. I don't know a single person that goes to 12-step meetings that would sit across a room from me and hear me say, I don't have a disease. I'm not an alcoholic. And would interpret that as, oh, that's just how you are opting to recover. No. It's very clear, black and white. If you question that framework in AA, you will be met with, that's your disease talking, right? That's your ego. That's resistance. That's denial. In a sense, in 12-step meetings, if you disagree, that's like a symptom of your disease, right? And it creates sort of a closed system. And I really feel like that's exclusionary because we need a bit of discourse, right? When we're talking about science, in science, when there's a disagreement, it leads to investigation. And when you're in an echo chamber in a closed system like that, disagreement is pathologized. And I don't agree with that. That's where my red flag goes up. That's where the spidey sense goes up, is I feel like it can be an echo chamber. It can be a silo. Any system that discourages questioning will risk becoming an echo chamber. And echo chambers turn into silos and you stop learning and hierarchies form. There's people who are doing it, quote, right, and there are people who are not. And this language sort of shuts down that dialogue instead of engaging ideas. And that's not how science works. That's not how learning works. And it's certainly not how a nervous system heals. So when I got farther along into AA, and I realized that I absolutely had no choice but to adopt this definition that I had a chronic relapsing brain disease, and I was in fact an alcoholic. If I didn't really internalize that, then I was going to be outcast as that's your disease talking. It raised so many red flags for me as a nurse, as a person who studied science, and as a woman who's always been told what to do and what not to do and how to think and not to trust yourself. It was like one more thing, right? It was one more area where I don't get to trust myself. And again, disagreement became a symptom. Oh, well, you're in denial. You're in denial of your disease. Your disease is in the parking lot doing push-ups. And people would say really condescending things to me like, I will save a seat for you when you go out there and try some weird way and it fails because you have a disease. Now, also these people were very loving and trying their best to keep me safe. And in this echo chamber, it's all they knew. You don't find a lot of people in 12-step rooms that have researched the fuck out of neuroscience, that have studied addiction. You don't find people engaging in alternative therapies and really being open to a dialogue of new literature. You just don't find that. It's a silo. And you're either in or you're out. My husband said it perfectly. He said, AA is the only group where if you're not with them, you're against them. And I was like, yeah, that's exactly how it feels. Like, I can't just be, right? You know, in one of my episodes, Dawn Nickel and I from She Recovers were talking about how if the only requirement for AA membership is the desire to quit drinking, then yeah, we'd be members. But it's not that fucking simple. Anybody who's been in 12-step knows it's not that simple. You will have to adopt this. Now, let me get into why doctors have adopted this. We are talking about primary care providers who have learned a little bit about everything in the body and a lot about nothing. And I am not a nurse sitting here telling you that all doctors are wrong. But what I'm telling you is they've learned a high-level overview, and it has certainly been rammed down their throat that addiction is a disease, because we really want to encourage our medical providers to treat this, to not just brush it off, to not treat people like it's a moral failing, because it's not. It's so much more nuanced than that. And people are dying if they don't get treatment. So we've hammered this in to nurses, to medical providers. It's a disease. Send people to AA. They send doctors into AA. And I will tell you that if you are a primary care provider, you don't have the time nor the inclination to look heavily into this stuff. Unless you're studying addiction science, unless you have a personal stake in the game, you're not going there. I've said this before, in nursing school, I think the SUD portion of our training was all of like one chapter. Like, this is what it is. This is where you go. Moving on. Because most of the time, it's going to come up as a side issue during an appointment about blood pressure or something life-threatening. And so a lot of providers will brush this off and or default to the easiest gold standard, which is it's a disease, it's a chronic relapsing brain disease, go to AA. AA is everywhere and it's free. And for that, it's been a beautiful thing. It has helped millions of people. But there comes a point for many of us when red flags go up, when we realize we're in a bit of an echo chamber. And the hierarchy that I've noticed in 12-step rooms, where the people, quote, doing it right, they're the ones who get to be condescending, who get to tell you that's your disease talking. That's not helpful. That's not humility. That's not love. That's not recovery. It's not embracing people. It's like talking out of your ass is what that is. And I'm not for that. And I think especially because we're in the Trump era and there's so much icky rhetoric going on and there's so much control, it's just one more thing for me where I do not need someone talking down to me in a domineering way. As a woman going through the Trump administration, I don't need that. In fact, it kind of makes me shudder. You know, that's in the same way that organized religion makes me shudder, because in our society today, it feels very weaponized. It feels very, I don't know, AA feels MAGA to me. I'm going to just say it. It does. I have no scientific basis for that. And if that's upsetting to you, then, you know, you can send me a rage email, but it just does. I can't quite put my finger. Maybe I'll do an episode on that. But essentially, it's why I kind of built my own framework, why I built the Rewired Sober framework around learning and not necessarily disease management. You know, in my framework, I say first we're going to repattern, we're going to interrupt those learned loops, we're going to reveal, we're going to understand what that behavior solved for you. We're going to understand why you used it to self-soothe. We're going to understand all of it, right? Because, you know, intersectionally, you're coming to recovery with a lot of layers and a lot of pain and trauma. We need to peel back those layers, and we need to then reframe and remove shame through context, and then reclaim as the final step in restoring agency and self-trust. Because this to me matches how the brain actually changes. Like, if something can be learned, it can be unlearned and relearned, right? And I really wanted more autonomy, especially for women. You know, you're coming into recovery already disconnected from your self-trust. And I feel like models that require surrendering authority can unintentionally reinforce further self-abandonment. And I feel like healing really requires a choice and some agency, some participation and understanding, not obedience. So I guess I would say, to me, you know, obviously addiction's not a moral failure, but it's also not a chronic relapsing brain disease. P.S. Some people never relapse. It doesn't necessarily require a permanently diseased brain. Now, during active addiction, your brain is diseased. We've talked about that. That can be proven. There are brain changes. During active addiction, your reward pathways are hijacked. You are not thinking clearly. You're not making the right decisions. Your emotions, your neurobiology is all over the place. Your electrolytes are all over the place. Your body is fucked. So yes, inactive addiction and maybe early detox, you're freaking diseased as all get out. And it does take time for that to level off. But that doesn't mean that you have a brain disease like myasthenia gravis or Lou Gehrig's, I want you to look into the concept that it's a learned response and sort of wrap your head around the hope that it can change when conditions change. I'm not saying all this because I want to bash on the disease model. Again, it really helped us move out of blame and criminalization. But neuroscience gives us a more accurate explanation and more flexibility in how recovery looks. And this matters, right? This matters because what people believe about change will shape whether you think that change is possible. It will shape whether you believe healing and recovery is possible. Our thoughts create our reality. So this is all important. I hope this was helpful in breaking down how the disease model came to be and shining some light on the fact that it's much more nuanced than this. There is much more gray area. And I think the overarching commonality of all these researchers is that this just needs more study, more research. At the end of every clinical article I've read is basically comes to the point of saying, we need to do more research. We need more evidence. And we specifically need to research on women. We don't research shit on women. We research on men. Women are too hard to research on because of our hormones. And so a lot of the research and the scientific articles, the clinical trials that we come across as women, it's like, that's not even relevant to our neurobiology. It can be very frustrating. But in understanding the brain, we know a lot more now than we used to. And if someone tries to scare you or shame you or put you in a box, arm yourself with knowledge. So I hope you found this helpful. I'm going to wrap it up because I'm coughing like a mug and I'm spitting all over my microphone. Thanks for spending this time with me. I love you all so very much. And I mean it. You can find me on all the socials at Rewired Sober. The links to join my coaching program are always in the show notes, as well as an email if you want to get in touch with the pod. So until next time.